In the next few minutes, I'm going to be talking about headaches. And in this session, I'm going to be talking about paroxysmal hemicrania, cluster headache, and idiopathic intracranial hypertension. Now, I'm going to be discussing these three kinds of headache under the following headings. I have placed paroxysmal hemicrania and cluster headache side by side because they look very, very similar. There are only a few subtle differences between the two, which I will highlight as we go on. Now let's start with paroxysmal hemicrania. Paroxysmal hemicrania usually presents with one-sided, throbbing, boring, claw-like pain around the eye, with redness or tearing of the eye, drooping or swollen eyelid, and nasal congestion. Frequency of the symptoms about 5 to 40 times per day, and duration of the symptoms is about 2 to 30 minutes, and it's more common in female. In contrast to that, we have cluster headache, which is very, very, very similar to paroxysmal hemicrania. One-sided, throbbing, boring, claw-like pain around the eye, drooping or swollen eyelid. But what then is the difference then? Cluster headaches is more common in males, while paroxysmal hemicrania is more common in females. Now, we also note you can also note that cluster headache also lasts for about 15 minutes to 2 hours, while paroxysmal hemicrania lasts for about 2 to 30 minutes. Overall, one of the most important differences is sex. Just look out for the sex. If you have a patient who is presenting with one-sided, throbbing, boring, claw-like headache or claw-like pain around the eye, with redness or tearing of the eye, droopy or swollen eyelid, check out the sex. You see. Now, what is the treatment for paroxysmal hemicrania? The treatment is indomethacin, other NSAIDs like calcium channel blockers and steroids. On the other hand, cluster headaches can be treated with oxygen and triptan, and the prophylaxis is verapamil and prednisolone. I put a short note here. It is for us to know that alcohol could trigger cluster headache, and triptans may also lead to tingling and chest tightness. In this part of the table, we have idiopathic intracranial hypertension, which is common in overweight women. It is usually bilateral and presents with blood vision. Examination of the eye will reveal bilateral blurring of the optic disc, and the treatment is LP or acetazolamide. Remember, one of the predisposing factors is prednisolone. Now, before we finish this segment, I would like to talk about some other kinds of headaches that could occur in our patients. We could have sinus headache. Usually, patient comes in complaining of headaches. If you take a very good history, you might also be able to know that the patient also has some sinusitis. So this is the giveaway for sinus headache. Now, tension headache is usually another common presentation, one of the commonest forms of headaches. It is usually precipitated by stress, tiredness, or dehydration. Okay. I would also like to make a mention of medication overuse. This is a situation in which patient has headaches because of use of different sort of medications, including painkillers. The way to stop the headache is to stop the medication. Okay, so this will be all on this segment of headache. I will see you in my next video. Thank you.